All right, we're recording now. Okay, hi everyone. Hi to anyone who's watching it later on. We've got Jared here, we've got Jamie Lee and Christy as well. First of all, I'd like to acknowledge the traditional custodians of the different lands that we meet on and pay respects to elders past, present and future. Today we're doing the second part of the smoking cessation skill set. Last week we talked about the effects of smoking and the interactions with medications, and what are some other things we talked about last week, Jared? I've had a bit of a blank there.
I'm looking at the physical ailments. I think I'm looking at the foot. I can see pictures
yes,
last week.
Yep.
And it's not glaucoma. What's the other one?
Macular degeneration.
That's it. So we sort of spoke about physical, mental issues.
And we also talked about the different groups that smoking cessation programs target. So like our pregnant women, breastfeeding women, young people, people with a mental illness, people who've got a smoking related disease, anyone who identifies as Aboriginal or Torres Strait Islander, and the reasons why, because we don't want health to get worse, pretty much.
And the barriers to giving up too, I think, was the other one.
Yes, we did talk about that, didn't we? About, you know, especially when you're around people smoking and being angry and irritable, and sometimes someone else just goes, oh, just have a smoke because we're sick of you. Okay, so I'm going to share my screen now. Is that, can everyone see that?
Yep.
Cool. All right. So within this section, we're just going to talk a little bit about, you know, self-help and other things we can do to assist with people giving up and what the best practice is as well. Okay, so I want you to, if you can, unmute yourselves, put your camera on, and tell us about any types of treatment, any types of, you know, pharmacotherapies for giving up smoking that you can think of, and other non-pharmacotherapies.
So you got your NRTs?
Yeah.
So your lozenges, patches, sprays, inhalers, gum.
Yeah. Lozenge, patch, spray, inhaler, yep, gum.
Yep, lozenges.
Yep.
And
who's on the Champix?
Yeah, that was my next one too, because I'd done Champix when I gave up.
Yep. Some people think it works really well. Are you on the Champix, Joe?
I know, I used to be.
Ah.
Yep.
So the Champix, so some people say it works really, really well. Yeah. Yeah.
Oh, right, I reckon it works better than patches and stuff.
Yeah. All right. Jamie Lee, you got any anything to add to that there? So think about things that we might use that that isn't like a medicine-based thing.
I know that I had to keep busy, so active. Instead of, I guess, you know, when you're idle, you're sort of probably more susceptible to sparking up. But then if I was busy playing sports or doing something, I wouldn't think about it.
Yep. Yep.
I also found that I had to change what I was actually doing. So, you know, in not sitting where I used to sit when I was smoking, you know, so I'd go somewhere else.
Yep.
stuff.
Yeah, I found I had to stop having a coffee in the morning because I just couldn't get past having a coffee without a cigarette. Yeah.
And it's the same with alcohol too, I think.
I still haven't got past that. I'm still working on that. The drug smokes don't count, I reckon. Yeah. What else can we think of?
I think it's hard when you're at work, and I think apart from just changing the habit, it's changing the way you deal with stresses.
Yeah.
I'm not saying do yoga or zen out, but that might help people. It wouldn't help me. But just to try and instead of, that's it, I'm walking out, I'm going to go and have a smoke. For me, it was food. So I just start eating. So I put on heaps of weight. But I stopped smoking.
Yeah. What about like motivational interviewing and that sort of stuff? You've had much to do with that? You're probably doing it without even realising it, but it's definitely the evidence is there for motivational interviewing. So it's talking about actually, planning the idea. So if I'm talking to Jared and then, I might start to give him the idea so that he starts to think about it and then it becomes his own idea. And, it's about motivating him to, make it his own decision, be more motivated to give up smoking. Did that make sense? Probably not. But the evidence is there. So for anyone that says, remember when I went on about last week, anyone that says, oh, we don't have time to do that, but all the evidence in all the research done, they say that, every bit of input helps someone to eventually change their stage of change that they're at. Did we go through the different stages of change last week?
I don't know.
I know. Well, they're not quite 35 years together, but getting there, like they've been around for certainly about 35, 45 maybe.
I can't remember. Anyway, so the evidence says that the best practice is your counselling, your motivational interviewing, and your pharmacotherapies. Okay. So it's not saying that one's better than the other. It's saying that a combination is good. Okay, there is a video link that I've put in the post section for this video, which is about NRT and who can have it and who can't have it. You can watch that at your leisure. Because to be quite honest, that woman annoys me in that video. So who do you think can have NRT? When we're talking about gum, patches, lozenges. When we're talking about nicotine replacement therapy, we're not talking about your Chantix or your Zyban. We're just talking about nicotine replacement therapy. So who can have it? Is it safe for pregnant women? Is it safe for teenagers? Is it safe for who can have it? Can you have it if you've got heart disease?
Well, it's not really safe for pregnant women to have patches on. They have to be closely monitored if they need to use patches.
Yeah, so because the nicotine actually crosses the placenta, but so if you can give up without it, then that's preferable. But if you can't, then that's the next safest option to do, rather than be smoking. Okay, do you think it's okay for adolescents?
Not really.
Okay, what do you reckon, Jamie Lee? Oh, and you've got to fire out those comments in there, Jamie Lee. Get typing so we can. What do you reckon, Jared?
Well, The only thing that I'd be concerned, I guess, there's people that I know that have given up smoking but can't get off nicotine replacement therapy.
And is that a worry?
Well,
that's a problem.
You know, it is. I guess it is a worry because I mean, you know, one thing is when you're actually physically smoking, you know, you think about lung cancer, all those other things. With the nicotine, look, I wouldn't recommend that. I would recommend it, but I'd have to say, you know, you'd have to make sure you're monitored throughout the whole thing as well.
So do you think if someone used nicotine patches for 6 months, do you think that's okay?
As long as they followed the routine or the regulations that they, what do you call it, the steps.
Yeah. So basically, even if they're using the ongoing nicotine, they're still not getting all those other nasty chemicals, you know, all the nail polish remover and, you know, all those other things we went through last week that are in there that you wouldn't actually think are in cigarettes. Okay, so if you have a heart problem, you hear of people who have had a chest pain or something, they go into hospital if they're in coronary care and they'll probably be put on nicotine patches. So it is safe for people that have got heart problems, and it's the benefits are going to outweigh the risks. But remember, anyone who's got those underlying conditions, they still need to go and see their GP and get monitored closely, especially with medications. Kidney problems? Oh, sorry. What did you say?
It can give you a racing heart.
Yeah, that's right. So that's why it's important that it's done under supervision. They don't just duck down the chemist and then slap 3 patches on, so that it's right for them and for how much they smoke. But if they've got a heart problem and they want to give up smoking, then NRT is the safest option for them. But yes, you're right. It can give you that racing heart when you have too much nicotine. It's okay for people who've got kidney problems. And it's okay for people who want to use NRT for a long time use, like over 6 months. So, and really what they're doing is weighing up the risks, so the benefits and the risks of ongoing smoking or, you know, the risks of continuing to smoke. Like I said before, like with the nicotine crossing over the placenta, then it is better if mum can stop smoking without any help. But if she can't, then it's the better option. Okay. And kids over 12 years of age can have NRT. Remember, you'd want to have, with any of these, that needs to be done under supervision, like of a GP, and so that they've been assessed properly, because you don't want to be giving them like a massive dose of nicotine and getting bad side effects if you can avoid it. Okay, that just sort of reiterates what I was talking about with the nicotine, with the interactions with medications. Okay, so it's really important, like I said last week, for your different medicines when you're giving up, to make sure that the nicotine, because when it interacts, it can give you a high level of the medicine in your blood or a low level. So it's very important they're monitored. And I don't think that is always done very well, and it's something we really need to work on improving if we want people to have good quit attempts. Sorry. Okay, this is just a bit of a recap on the different effects in with medications. So this is the effects with nicotine replacement therapy and the medication. So with your warfarin, can reduce your levels. So remember last week we talked about some medicines, and it's not actually the nicotine that affects it with nicotine replacement therapy, but it's actually the other chemicals that are involved in smoking and the how it's metabolized. So it's really important that you remember that is the tool 7 and the tool 8 that's on that I showed you last week, that you look that up to make sure. Okay. We talked about the effects on insulin and all of these other drugs as well. Okay. Now, when we're talking about triggers, it is really hard to give up when everyone else is smoking around you. So, and I think if you do a really good assessment with people when you're talking about giving up smoking and they said they want to give up smoking, talk about what they know their triggers are. Like, you know, what worked for them last time. If they had a good crack at it last time and then they had something, you know, something traumatic happen, then they started smoking again. You know, it's about removing those things. Obviously, you can't remove those traumatic events and extreme stress mostly, but for things like, you know, maybe not going out to wherever you're going to smoke normally while you're just trying to give up. Maybe introduce that later on when you've been doing okay. And I guess, you know, we were talking before about breaking the habit, doing different things. So if you know that that's going to lead you to smoke, then change the habit, plan for it, plan to do something else instead, so that you don't have another, or lessen the chance of having a failed attempt, or not failed. I shouldn't say failed, I should say unsuccessful attempt. When we talk about the benefits of quitting, I know we sort of went through it a little bit last week, but we'll just do a recap on that. So basically, as soon as you stop smoking, your body starts to recover. Within your heart rate will slow down and your blood pressure will lower a little bit. And within a day, you get all the nicotine out of your system. And because you've got this carbon monoxide that's floating around in your body, it replaces where the oxygen binds to on the hemoglobin. And so really, you're not getting as much oxygen around in your body. So you're going to be getting more oxygen around your body to all your muscles, your heart, your brain, everywhere. And I mean, that's especially important for people that have got really poor circulation in their legs or leg ulcers, those sorts of things. Within a week, you might start to taste things a bit better and smell things that you hadn't smelled in a while. And you've actually got, remember when we did the respiratory system, you got all these little tiny little hairs inside your lungs. And so what happens is they start to be able to work again to clean the gunk out of your lungs, because they're not all clogged up with tar and you know, that stuff. Okay, within 2 months, you're going to be coughing and wheezing less, and you're probably going to be able to get over being sick a bit easier. Immune system's going to recover a little bit. After 6 months of giving up smoking, you're going to have less phlegm. You're going to get rid of that cough, and you're going to be feeling a bit better. Remember though, like even if someone's given up for a week, you still got to encourage people, and because it's really hard to give up smoking, and if they can do it for a week, they can do it for longer. So no matter how long they manage to give up for, make sure you really, you know, tell them they did well, because it is really hard. Okay, within a year, your lungs are going a bit better. You're probably breathing a bit easier. Now, this is the interesting stuff, is that once you get to 2 to 5 years, your risk of your heart attack and your stroke drops. And then when it gets to 10 to 15 years, then your risk is lowered down to for someone who has never smoked for heart attack and stroke. So that's pretty good. You know,
it's a big gap though. Like when you look at what is it, after 2 years, the risk of having a stroke or a heart attack, you know, is lowered, but then 2 to 5 years, the risk of heart attack and stroke drops. But then 15 years, That's a long time, isn't it, for your heart and for your for your heart to recover, basically.
That's a long time not to have snuck any smokes.
I know.
It?
Yeah. Long time between drinks, Christy.
Yeah. So, I mean, I'm impressed that it can actually lower down for someone who has never smoked.
Yeah.
I suppose it really depends on how much that person smokes. Yeah. And there is a thing called pack years. Have you ever heard of that?
No.
You might get asked in some spirometry machines how many pack years. So you can just Google pack years calculator. And this pack years thing, so you just put in how many smokes per day you had for how many years. So let's say 12 smokes a day for, we'll say first about 10 years, okay? And then gave it for a while and then had, 5 smokes a day for 2 years. And then, so you can add in some other, like, if you've been smoking tobacco, like maybe smoking any weed, you can put that in there as well. So what it does is it calculates how many years it's been equivalent to you smoking a pack a day. Okay. So that equates to 7 pack years. So it's just something to be mindful of. If you hear about pack years, that's what they're talking about. Just Google the calculator and stick it in there, okay? Okay, now this is a bit of an activity. So let's say your team is going to run a health promotion activity for World No Tobacco, which is the 31st of May every year. What kinds of things could we do to raise awareness about the short-term and long-term effects of smoking? And who could we target? And what would be the strategies? Have you got any ideas? Let's say it's in your workplace, Christy and Jamie. Are you still there? So, Jared.
Yep.
What things can you think of for running a health promotion activity for in your team?
Well, I think the Ready Mob, they've done a few things over here. They're at every event. What they've done in the past, Jamie Lee's just put down using social media to raise awareness. That's a good idea.
Yep, definitely. Yeah.
More than anything else, it's prizes, winning stuff. It sort of gets you motivated to have a crack at it. Plus, I think they make you feel part of a team more than anything else. It's that.
Yeah.
The thing that you're not alone and you got other people there for support.
Yep. Yeah, I think that's they're good strategies. So if you were going to do it in your workplace there, Christy and Jamie Lee, let's say if you were going to target the workers, what are some things you could do? Like you do your social media. What are some other things you could do?
Sorry, I missed half of that. What was that?
If we were going to run a health promotion activity for World No Tobacco Day in your workplace for the staff, what sorts of activities could you do to help raise awareness?
Oh, so like put up flyers, posters.
Yeah. Giving talks as well. Yeah. What other things do you think would be helpful for your team there to get some people to give up smoking in the workplace?
I don't know, stop them from being able to go out and have a smoke.
What, lock the door or something? No, you're not allowed out.
Yeah, pretty much, yeah.
I know that there was one place that they had like the artificial lung sort of thing. That was pretty gross. And they had it smoking this artificial cigarette. That sort of stuff made you want to vomit.
Yeah, those really visual things. Yeah, I've seen that with all the gunk comes out. That
Yeah, it's
yeah.
that shock. The shock value of it is pretty crazy.
Yeah. What were you going to say then, Christy? No, Jamie? So you got display some smoking cessation stuff. Have the team giving some talks. Target everyone, having support, and people can start smoking at any age. Yep. Social media. I like I like what you said, Jared, about that motivation, like a prize or something like that, you know, so, and everyone's got, you know, the group for support as well. Can you think of anything else that we might do? Like there's lots and lots of activities you can do. You just got to get creative with it. Haven't you really? And make sure you know, you might even have to start making TikToks. Gotta keep with the time, haven't you?
Oh no.
Okay, so that's the end of that section there. Now let's go on to this one. So this is screening clients. So in your assessment, there is a couple of case studies where you have to actually screen the client and you give them a score on the Fagerstrom scale and work out what their dependence is, and then work out what level of, you know, what type of NRT would be right for them. Okay, also in your assessment, there's a question on the DSM-5. So the DSM-5 is a book that's published by the American Psychiatric Association or something like that. And basically they've got every sort of diagnosis listed in there with, you know, the criteria for a diagnosis. So it's aimed so that it's a standard thing across the board, so that if I presented with some symptoms, they'll go, okay, you tick all these boxes, you're diagnosed with that, for different disorders. So they also include a substance use disorder as part of the DSM-5, and I'll show you what it looks like. So they say that to qualify for having a substance use disorder, you have to have at least 2 of these 11 criteria. So if you think about smoking, you know, it's pretty easy to get 2 of these criteria, isn't it? Withdrawal symptoms when not using. Yeah, so you get withdrawal symptoms.
Mm-hmm.
Continued use despite problems caused or made worse by use. Unsuccessful efforts to cut down. Craving for a substance. So there's, how many have we got there already? Quite a few. So you only need 2. And so if I qualify for all of these, then I've got this level of substance use disorder diagnosis. Okay. Does that make sense? Yeah. So in your assessment in the case study, you've got some different information on each of your case studies, and it says, you know, which criteria does the person qualify for. So that's what it's talking about. There is a question in the first part of your assessment that talks about, you know, what is the DSM definition of a substance use disorder, and you just need to write the little definition in there and talk about this. Okay. All right, so we've hammered it home enough about, any questions about the DSM-5 criteria? Jamie Lee, you good with that? Okay. Routine screening. So if I haven't gone on about it enough, we need to be doing it. Everyone needs to be involved in checking about smoking status, and everyone can be involved in it, not just leaving it for someone else. It's everyone's business. That's what the big push is for everyone. Okay, there is the Fagerstrom scale, which I'll show you in a minute. This is it here. So what we do is we go through it and we give people a score. So Jared, do you want to be my guinea pig there? All right. How soon after you waking up do you smoke your first cigarette?
Straight away.
Straight away. So we're going to say within 5 minutes. So we give you a score of 3. All right. Do you find it difficult to stop smoking in places where it's not allowed?
Yes.
So we'll give you a 1 there. Which cigarette would you hate to give up?
Oh, the first one in the morning, definitely. After that, I could be killing people, I think.
How many cigarettes a day do you smoke?
If I said 20, it's probably more like 30, so between 20 to 30.
Yep, so I'll give you a score 2 for that one. Do you smoke more frequently in the morning than in the rest of the day?
Yeah.
Yep, so we'll give you a 1 there. And do you smoke even though if you're really crook and you've been in bed for most of the day?
Yep, can do.
Yep, still haul yourself out there to get a smoke?
Oh, yeah, yep.
Okay, so I'll just add that up. So we've got 3, 4, 5, 6, 7, 8, 9. So you got a score of 9. So if we look down the bottom here, 8+ is very high dependence. So then what we do from there is we go and have a look at the scale of what they recommend. Okay. Just hang on, I'll just bring that up. This is the part 2 of the assessment, and you'll see in here we've got, here's the Fagerstrom here, we've got a case study here, and it gives you the answers for these questions. And on the next page, on page 8, we've got the Fagerstrom to fill it in, tick the boxes there, and we've said we've got a score of 9 for Jared, not for this one. And down here you've got a recommendation chart. Okay, so for high dependence, this is what the recommendations are here. Okay, so we're going to give him a 21 milligram patch, or we're going to discuss it. We're not going to prescribe it ourselves, but this is what would be recommended for him. An inhaler, some lozenges or gum as well, okay, because he's going to need that probably a bit extra. And look, for people that have really high dependence, they can have 2 patches on to reach that level of what of nicotine that they were used to. Because remember, without that nicotine, we've got those little receptors in our brain screaming for a bit of nicotine, and we haven't got that lovely happy hormone getting pumped out when the nicotine binds to the receptors. Okay, so this is our 5 A's. So throughout your assessment, you'll see the 5 A's a fair bit. So the first step is ask, and we're going to ask, do you smoke? Yeah, because you don't want to go into all this stuff here if they don't even smoke, do you? All right. Now, the next one is assess, not advise. There's been a little stuff up here on this. We'll go on to this page here. So ask all patients whether they smoke or not. That's a good start. And you'll find that it's one of the required things. And you'll probably have reports in the clinical setting where you have to fill in smoking status because it's been missed. Okay. Assess. This is where you're going to ask about, are you interested in quitting? Do you want to stop smoking? You know, how did you go last time you quit? Did you have you tried to quit before? What are some other things you think we might ask here? Any ideas? Especially when you're asking about their previous quit attempts.
So have we asked how many times?
Yeah, if they've tried to quit before, how many times they've quit before? What about what things sort of
Trigger.
yeah, triggered them to start smoking again from last time? Yeah, that's right, Joe. Jamie Lee and Christy, you got any other ideas for what we might ask here? Did they use patches last time? Did they try Champix? What did they do to help quit? Did they just go cold turkey and didn't find it successful? Did they say they would not like to use nicotine patches again because they had terrible nightmares? So, because, you know, you need to get a bit of background here and find out what you could do, what you could recommend, and where you could work with this patient to have a good quit attempt this time. There's no point going, oh yes, off you go and slap this patch on, and see you in 6 months' time. If they don't like patches and they hated having terrible nightmares for leaving it on at night time, you know, it can be simple things that you can talk to them about. Which brings us into our next stage, which is our advise. Okay, so it's advising all smokers to quit, you know, and I think it's really important in this stage is that you do it in a way that's not, you know, judgy. You know, if someone has diabetes and a leg ulcer, then maybe you might be saying, you know, if you give up smoking, it'll actually start to, you'll get a bit better circulation there, and it'll start to help your wound heal a bit more. You know, make it relevant to the person and what the benefits for them are. You got anything else to add in there?
Yeah, look, I think it's important not to be judgmental. That's probably one of the biggest things, and it's the fact that, you know, that person's taken that step to make a decision to even if it's thinking about quitting, well, you know, fantastic. But you know, then to turn around and say to them, well, yeah, it's about time or something like that, and you know, that's not going to help anyone.
No, and they're just going to go, well, I'm not going back to see you again.
Turn it into a positive. I think more than anything else, it was finances.
Yeah.
Like Mel saying, look how much money we've saved, you know, and you think, wow, it's awesome.
I'll give you the exact number.
Hang on, she's telling me now from the kitchen. How much?
In about 130 days, that's about
130 days, 4 months.
$4,000.
We'll save $4,000 between the two of us.
Wow, that's a lot. That's huge, isn't it?
Yeah, so that's the motivation part, and you know.
Yeah.
But yeah, I think saying to someone, you know, who if they have had a crack at quitting, you know, good on you. Turn it into a positive.
Yeah. Yeah. And I mean, everyone knows that, you know, it's good for you to give up smoking, but you know, you need to make it, that's right, positive and relevant to the person as well. And non-judgy. We don't like judgy. Okay, the fourth A is assist. So this is where, so from the last few steps, you're going to have sussed out whether someone smokes, how much they smoke, if they've tried to quit before, are they ready to quit now? So let's say if they're ready to quit, so this is where we're going to start helping them get organised to have this quit attempt. We don't want to be setting people up to fail. We want to make sure we've got everything in place so that they have the best chance possible to quit. If they're unsure, so I guess it's about leaving the option open for people to come back and say, look, you know, well, look, if you do decide that you do want to give up smoking, you know, give me a yell and we can get you in and go through the process and see what we need to do. You know, don't just fob it off, like always leave the door open for people to come back. And if they're not ready, you know, that's it. Just make sure you're giving them that option. if they have given up, then, you know, we want to be making sure we're giving them that positive feedback and congratulating, because they've done well. They've done a great job if they've given up. Last one, number 5, is arrange. And this follow-up stage is really, really important. So, you know, it's all good for us to go, yeah, here's patches, see you later. Yeah. But that follow-up, especially you'll see in the case studies in your assessment, you've got a man who's, I think he's got lots of chronic disease, and he lives with his family, and everyone smokes inside, and he's got lots of stuff going on. I think he's got some mental health, a mental health diagnosis as well. So really making sure that you are doing the right follow-up. Some people might need it every couple of days or every day for the first little while. Depends, you know, this is what your whole assessment's about, seeing what you're going to do with how often you're going to see a patient, and whether it's going to be a phone call or you're going to see them in the clinic. Okay. And if they have, like, you know, if I ring up Jared and say, oh, just checking in on you, seeing how you went with your smoking and how you're going now, and he goes, yeah, you know, I haven't had a smoke for 2 days. Or he might go, I haven't had a smoke for 2 days. And then, you know, make sure that I can give him a bit of support and say, look, you're doing really well, that's great, and maybe he's just needs a little bit more NRT or something. So helping get those other supports in place and any appointments he might need to help him have the best chance at the quit attempt. And, you know, if someone does start smoking again, you know, not making them feel like shit, because, you know, if I go back and I make Jared feel really awful because he started smoking again, he's just going to go, no, stuff that Christy, I'm not going back to her again. She's just a real bitch. So make sure you're doing it. It's all how you do it, really, isn't it?
I wouldn't be that harsh.
So, okay, we talked about the follow-up. Now, this is the stages of change, and you also got the stages of change in your smoking study guide. So it's just talking about what's happening in each stage. So pre-contemplation is when you're not, you know, not really thinking about it, you're not too worried. Contemplation is where you're like, oh yeah, I want to give up smoking. You're starting to think about it. Your preparation, where you're getting stuff in place, you're getting some patches, you're going to set a date, you're going to do it. Action is you're actually doing it. And maintenance is, you know, being able to maintain that. And then, of course, if you relapse, then it goes back around again. Or you might be able to maintain that maintenance stage and you have given up. So there is a question in your assessment that talks about the different stages of change and what happens in each stage of change. So it's about whether they're ready or not and whether they're thinking about it or not. Here's just another picture about the stages of change and, you know, what's happening in each part of it. Right, that's the end of that. Now, have we got any questions about smoking cessation?
It's not easy.
No,
that's not a
it's
question,
not
that's
easy.
a comment.
It's very hard. I got sent home from work when I gave up smoking because I was such a psycho bitch. Yeah.
Well, just what's sort of funny though, like, you know, working in the health industry, how many health workers are smoking? You think, you know, I don't say anything, but sometimes I think, hey, we're in an industry where we're trying to help or support people improve their lives. We're out there sucking on durries. But, you know, the amount of times I was sort of thinking while you were talking before about how many times I've given up and started again. And then there's times where it was just, yeah, I'm going to give up. And it was like a one-day effort. It wasn't even an effort. It was just, yeah, I'm going to give up. But I guess, you you know, when it comes down to it, that thought, it was always sort of sitting there. Until your kids tell you stink, or they don't want you to come too close to them, or whatever it is, you know, then you start to really sort of think about it then.
Yeah, and I think it's about picking the right time too. Like if someone's got lots of stress and stuff going on in their life, like, you know, is that the right time for them to be doing it right then?
And, you know, even I was sort of thinking about ads. I was talking to somebody about ads that we used to have. I might have been Adam. So I was in the office talking to him we were talking about COVID-19 of all things, and we're talking about, this is ages ago. So we're talking about, you know, epidemics and things like that. And I said, you know, when I was a kid, I remember the AIDS ads, you know, with the Grim Reaper bowling the bowling ball, and the smoking ad, you know, the one where the hook comes out and gets a person in the lip. Those things, I think, were pretty, you know, that smoking ad with the hook in the cigarette, that was like, hurt, like watching it, but still, you know, didn't stop me from smoking. I think it was other people, probably other people and their encouragement, and I guess what I wanted to achieve by not smoking more than anything else.
Yeah, and being around, like, that's a huge difference, being around everyone that's smoking, isn't it? Like, if everyone else is smoking, oh well.
Yeah, well, I walked back into TAFE, being the only smoker, and all the people that had given up started smoking again as soon as I came back. Yeah.
Bad influence.
I know. I didn't mean to be, but I did.
Righto. Well, that's the end of smoking, really. The only other thing that I wanted to say is that if you do, I think I was going to go through the next part of the assessment. Did I go through the first part last time? I can't remember. Christy or Jamie Lee, do you remember?
What was the question, sorry?
I didn't go through the second assessment last week, did I?
No, we didn't finish going through the first one either. You said that you were going to come back to other stuff.
Okay. Which would be the 5 A's, I think. Would that be right?
I don't know. I can't remember now.
All right. I'll just share my screen and quickly run through some of those bits that we hadn't gone through last week. Okay, so this is assessment task 1, and we went through it last week, but there was a few things that we hadn't covered. So number 11 is what's the internationally accepted definition of nicotine dependence in the DSM-5. So that's what we were talking about today, you know, the 2 of the 11 criteria, and you'll find that in your study guide. Hang on, I'll just grab mine.
Page 3.
Oh, page 3, there you go. The other stuff, okay, so our 5 A's. So you're going to see these 5 A's a fair bit in here. So in this one, it's define the features of brief interventions, okay? So what you're doing in each of the A's. So, you know, you ask, assess, advise, assist, arrange. I nearly had a blank then. Couldn't remember what the A's were. So in this one, don't just write those words down. You need to define it. So talk about what happens in each of them, okay? And give an example, all right? There was another section in here about the 5 A's. Okay, so this one, number 18, is give reasons why we perform brief interventions. So using the 5 A's. So why do we ask? Okay, why do we arrange follow-up? Why do we, you know, this is give reasons why. Okay. So you might think it's asking for the same thing, but it's asking for a slightly different thing in that question.
Yeah, that was confusing me the other day too. I was like, what the hell? It's virtually the same, but then, yeah, I was like, yeah, it's a bit different.
Yeah, a little bit different. Yeah. And in the first one, you've got to do examples in the first 5A's question, wherever that is, on number 14. So what happens in that, and give an example.
Yeah.
And this next one here, this is why we're doing it, okay? In each of them. Okay. Benefits of quitting smoking, we've sort of covered that. Now this is the behavioural change. So in your study guide, just hang on, I'll grab mine so I can get the page number.
Was it page 11?
What did you say, Christy?
Was it page 11?
I don't know, I've got to get mine from the other side of the room. Hang on a second. Okay, I'm back. Stages of change, yes, page 11. And like if you can, get some sticky notes or something and stick in this book, because it is a little bit hard to navigate what's where in this book.
I just got to duck out for a second.
Okay, I'll keep going with it. I'm pretty sure we went through those other things there. So I might just open up number 2, the assessment task number 2. So in this task, in this assessment task, you've got 2 scenarios. So the first one, the scenario, anything to do with the scenarios are actually in the boxes in this assessment. And you might see these 5A's again and go, oh, there's 5A's doing my head in. Okay, here it says using the 5A's, explain what questions you would ask Max and information you would give to Max. Okay, so this is where not just going to say ask, assist, advise, arrange, you know, you're going to give me some examples of what questions you're going to ask him and what you're going to tell him. You're going to go through, explain how brief intervention may encourage him to start thinking about making changes in his life. Now, there's a whole section in your book here on motivational interviewing, and that is from page 40 onwards. And remember here with number 3, it says, what instructions would you give to Max prior to him buying and using nicotine replacement therapies? But remember, has Max got any other health problems? Does he need to see a doctor? Okay. Make sure it's about the case study. All these questions have to be answered about the case study. Okay, so it gives us a little bit more information about the case study here. What information are we going to give Max on the type of nicotine replacement therapies available, as well as prescription-only pharmacotherapy? So when they talk about prescription-only pharmacotherapies, they're talking about your Champix and your Zyban that can help him quit. So you need to cover your NRT, different types of NRT here, and also your prescription ones like your Champix and your Zyban. We went through the Fagerstrom scale, and so for this one we've got his answers there for the Fagerstrom scale. So on the next page you're just going to enter that in there with the information from the case study. You're going to see what level of dependence he has from your score, and you write your answer there. And then let's say he's high dependence, or I can't remember what he is, then we're going to look at what the NRT recommendation is for his level of dependence. Because remember, we don't want to be going overdosing on nicotine because that's not going to be helpful. or underdosing him as well, because he's not going to have a very good chance of quitting, and we want to give him the best chance possible. So this is the answer here. Which one are we going to give him? And now in question 8, this is the user scenario, and you see whether he's classified as having a substance use disorder, which ones that he meets. You can circle them or write them down the bottom. And what it also says, and the extent of the substance use disorder. So whether it's impaired control, social impairment, risky use, or pharmacological dependence. Scenario 2, this is a pregnant woman, Jess, who presents to your service, and she's reading a Quit for New Life brochure. So after she has told you that she's a smoker, what are you going to do for Jess at this point? So you need to make sure you talk about it. Just changing that back. Talk about it with ask. So talk about that. Assess. Talk about that. Okay. You'll be sick of the 5 A's by the time you finish these assessments. Some information. So what information are we going to give to Jess to help her make an informed decision? So remember, Jess is pregnant, so you're going to want to include some information specific to, you know, giving up smoking in pregnancy here. Okay. What other instructions are you going to give to her before she starts taking any form of NRT? Is being pregnant a contraindication? That's the sort of information you're going to include in there. Oh, is that you there, Vicky? Hello. Okay, question 4. What information can you give on the types of nicotine replacement therapies available? And precautions need to be taken if you're using NRT while you're pregnant. And we're nearly done with this one. We do the Fagerstrom scale again, and we fill in the Fagerstrom form there. We find out what her level of dependence is and write it in. Then we find out if she needs any NRT. And this section here, this question 7, you need to actually write your notes in from what you've done for Jess. Okay, so when you've done the ask, assess, all that stuff, you need to write your progress notes in as if you were writing your notes into Chime or Communicare or Best Practice into your software. Okay, if you're handwriting it, that's fine. Remember, if you're handwriting it, you need to line it, sign it off, and print your name and your designation at the end of it, so that no one else can come in and write anything after you've written your entry. If you're doing it electronically, you can just type it in there and type your name at the end, that's fine. Legal requirements and responsibilities in relation to client privacy and documentation. So that's all stuff that we go over and over and over again. And you probably think by the end of this course, oh my gosh, this woman, she just goes on and on and on about documenting and covering your ass. Well, in coroner's court, you can't do documentation well enough, okay? And it's something that you will always be improving on as your clinical practice develops as well. It's something that's ongoing. And the last one is, what are your client's rights in relation to privacy of information?
Just tell her that one of the doctors will give her a call.
Who are we giving a call, Christy?
Oh, sorry, I pressed the wrong freaking thing.
Okay, and now for task number 3. This one is another case study, and this one is, what's his name? Jason, okay? You're working with the community mental health team as an Aboriginal health worker. He's come in for his depot, and during your normal follow-up, you do your routine screening for tobacco, alcohol, and other drugs. Okay, you've known him for over a year. You've been his caseworker for over a year. It goes on here, okay? He's got a few things going on. Lives with his partner and mother who both smoke. So it's really important you have a good read of the case study, and because you're going to be answering all these questions about that case study. Okay. Strategies and techniques you could use with Jason to help improve his motivation levels. Okay. About what sort of interviewing and counselling techniques that may be helpful. So you're going to put something in there about brief intervention and motivational interviewing. There's some barriers. You have a read of his case study there, and you'll see he's got heaps of barriers. And there's two parts to this question. Make sure you put in there about what's his level of risk for relapse when he next has a quit attempt as well. Can you identify any behavioural triggers Jason has that might cause him to have another failed quit attempt? So go through your case study, see what sort of behavioural triggers he's got there. So your behavioural triggers and your barriers are a little bit different. Okay, so let me just go back here to the thingo. Barriers, so that would be his mum and his partner smoke with him. When he drinks too much, he feels like a smoke. So that's a behavioural sort of trigger, isn't it? He becomes too stressed with the symptom of nicotine, and then he has a drink. And then when he drinks too much, he wants to smoke. So that's a behavioural thing as well. I think up here, he smokes a bit of weed as well. Lizzie smokes tobacco and he's smoking a bit of weed. So that's a behavioural thing as well, isn't it? Okay. What are we going to do? We're going to refer him. Who are we going to refer him to? Because he's got lots of ongoing, remember he's got lots of health problems as well. The legal responsibilities when consulting with other health workers about Jason, including health workers that are involved in their care and those that are not involved in Jason's care. So make sure you answer both parts of that question. Should we be talking to any health worker about Jason if they're not involved in his care? Back to the five. Oh, sorry, who was going to talk then? Christy?
Nah, all good.
Okay. Now, what information are we going to give to Jason so to help him have a good quit attempt? So put as much information in here as you can about what information you'd give him at each stage of the 5 A's, okay? And I think that's the last 5 A's, so you'll be happy that no more A's. Once again, we've got to do his Fagerstrom scale, rate him, score him, find out what is the best NRT for him, and you need to document your notes here. And the last question is about follow-up for this patient, when you want him to come and see you again and why. Okay. So it is a long 3 assessments because it's covering the 4 units of competency. So that's why. Right, any other questions?
Nah.
Any smokers wanting to give up? No.
I want to take it back up.
Yeah. From the stress of the 5 A's.
Yeah.
So basically those 5 A's, when you see them all the way through there, it's just that guide for that process that you should go through each time. with each person, and make sure you're doing a really good assessment on the person so that you're giving them the best planning for the best chance to, successful quit attempt. All right. Any other questions? Vicky, we recorded this, so if you wanted to, you can go back and watch the start of it since you missed the start of it. And Jared, you got anything to add?
No, I'm all sweet. Thank you.
Righto. Okay. Well, that's it for everyone, unless you got something to say. Or type, Jamie. Okay. See you next Wednesday.
Yep. Okay. Talk then.
Okay.
See you guys.
See ya.